Hey guys, it's Will from Start Training, here to have a bit of a chat about hamstring injuries and the road to recovery and return to sport. So the symptoms that are associated with a hamstring tear is obviously your pain and discomfort. Now that's either through stretch or through a contraction of the muscle as well. It can be as simple as sitting down, coming upstairs, bending to pick something up off the ground. These sorts of movements can all cause a bit of that pain and discomfort. Not to mention you get that decreased strength whilst trying to use your hamstring. Now the most common times you're going to tear or injure your hamstring is either like you're sprinting fast running, so it's at the end phase of your swing, or it is when you're pushing up off the ground, so whether it be accelerating out of a movement, so taking off, or even into like a jump. Now the most common sports that hamstring injuries occur in is often your team sports, so you're looking at your rugbies, your soccer, AFL, all those sorts of team sports where you've got that fatigue factor in as well. So you usually have high explosive movements, but you're meant to be able to repeat about it. The other sport often is your track and field, so you're really fast, high explosive movements, so your 100-meter sprints, 200s, those sorts of events. So now going on to a couple of risk factors that can possibly determine a hamstring injury. The main one that will determine a hamstring injury is actually a previous hamstring injury. So if you've done it before, you have a higher chance of re-injuring. Now, as I've written on the board, we've got our sort of progression through a sort of a generalized hamstring rehab protocol. So starting with number one is we're looking at our manual therapies. So we're looking to help develop the healthy scar tissue, which is helping making the muscles strong again from having torn. And we just want to make sure that develops properly and re-knits the muscle well, not so that it's going to less likely going to re-tear. From there, we're looking at going into your mobility and range of movement. Now, part of the manual therapy is getting your sort of passive range of motion. When we're looking at mobility and range of motion for number two, we're looking at a bit more of your ability to perform the movements. So we're looking at incorporating your stretches and like your active range and movement through it. So you're trying to get your full range pain-free. And that's pain-free is particularly important. So when we're pushing through into your more strength-based phases, it's not going to aggravate the healing process at all. Number three, we've got your muscle engagement. So we're looking at your upper and lower muscle, hamstring muscle engagement, not to mention your glute and your core muscles and all the sort of associated joints as well. So it's really important making sure that the muscles know how to activate and can activate pain-free. So when we're getting into a bigger gross of movements, that they're working well, which leads us into your strength and your neurological patterning. So your strength is obviously you're building that strength back through that muscle, aiming to not cause any further injury, and then making sure that ability to perform everything you were before, if not to a greater extent, is there. The neurological patterning is where we bring in and focusing on the ability to the muscles and the joints performing the movement, that the right muscles are firing at the right time, because the body will find a way to perform the movement. It doesn't always mean the muscles are working in the right timing. So if we can get the right timing going for these muscles, particularly through the hamstring, you're less likely you're going to re-injure. Now, when we're looking at the exercise selection side of things, your muscle engagement is your hamstring curls or your Nordic hamstring curls, which is one of the sort of gold standard exercises for your hamstring recovery. Looking at strength, we're looking at your sort of bigger, grosser movements, so either your squats, your deadlifts, all obviously lighter weight to start with and what you can cope with. But we're looking at those sorts of movements to sort of start really getting that strength back through the legs, whether that be RDLs as well, so just really focusing on that hamstring strength. Our adaptive strength, so that's really making sure we can perform strength through range and whilst moving as well. So we might be looking at a few more of your single leg exercises. So you're looking at like your split squats or like walking lunges or something along those lines, that just making sure all the muscles are working well together whilst we're performing the movements. And coming into number six, we're looking at your force and acceleration, sort of focus training. So this is, again, addressing one of the main points that can cause one of the hamstring tears. So we're looking at some of your exercises like your box, whether it be your squat jumps or drop squats. You're also looking at your more forceful sort of exercises. So it might be like your plyo lunges, so your alternating lunges. So it's really important to make sure all those muscles then working well together. And lastly, we come into our sport specific. So this is where we really start to target the movements that you're going to be performing in sport or in your activity or exercise that you're doing. So we're going to be looking at a lot more sort of like your jumping and landing, and whether it be a lateral side to side jump with it, and focusing that your ability to perform under fatigue as well is really there, because the last thing you want to do is go, it's feeling great, get back out there, get a little bit of fatigue 10 minutes into a game and tear it again. So that's where we're really looking to hit that sport specific movements for you. Now, all throughout, particularly in the last few phases where we'll bring in the running, and of course the sport specific running is definitely your much higher intensity and looking towards to regaining your ability to sprint. So then all that should be pain free as you're going. And just because we've numbered these out, it doesn't mean that they're all individual. We do tend to sort of overlap the separation here as well. Just making sure that we're hitting all points, and obviously not wanting to sit on the sidelines for months on end not being able to play. So we try and make sure that we can progress through the stage as well. So we might start to piggyback off each other and progress through as things are moving well. So we have a few considerations that we look for when programming as well. So you've got some of your general ones, which is going to look obviously your severity of the injury, which gets a bit of sort of personal and general. But obviously severity of injury will depend on where you start and how long it's going to take for you to progress through. But you look at all your mobility side of things, so you're going to look down through from ankle to knee to hip, through to your core control, and your strength from quad to hamstrings as well. We're also then going to look at some of like your engagement sort of patterning as well, so your upper versus lower, whether the muscles are engaging at the right times or not. So from here we look at your specific and personal sort of considerations we're going to look for when programming. Part of it, like I said, is the severity of the injury, so it incorporates like the scar tissue. But then we're going to look at your training history, what your end goal is important too, if it's to return to sport or just be pain-free. We look at how you've, the mechanism of the injury, so whether you've done it on the swing phase or whether you're planting. There's a slight sort of adjustment as to which exercises we're going to choose to target the right muscles. A couple of little things we might look at is sort of your running mechanics, and obviously your prior injury history. So if it's a recurrent hamstring injuries, often the rehabilitation is a little bit more in depth and can be a little bit longer as well, because it's not the first time you've done it, so there's going to be an extra build up of some of that scar tissue. If you guys are looking to learn a bit more about hamstring injuries, do check our website out as well. If not, book in for us if you want for a bit of an assessment on a hamstring, whether you're looking to prevent or if you're looking to rehab. It can sometimes just be a little niggling injury that sticks around for a while, so you may as well get on top of it early. Alright guys, see ya.